It's Wednesday, April 1st, 2020, and here's what's happening. We have the latest coronavirus numbers in Chautauqua County and what officials are trying to do to contain the virus. Plus, UPMC Chautauqua Hospital opens a specimen collection site.
And the sun is shining bright out there this afternoon, and that will continue through the day. We'll talk about it and more as the news at noon starts right now.
Live and on demand, this is WNY News Now.
And thanks for joining us for WNY News Now. I'm Justin Gould. Happening right now, we are awaiting Governor Andrew Cuomo's daily press conference, which is taking place in New York State, as he talks about the coronavirus and the statewide effort to contain it. During yesterday's press briefing, the governor talked about the impacts around downstate New York and how they're running out of ventilators. Now, the governor was under some scrutiny from folks because they say that he is stockpiling medical equipment. Although he says one of the big reasons why he is doing this is because he's preparing for the apex of the virus. We're always talking about that curve, which hasn't happened yet. And here's a live look at the governor's briefing room as reporters are getting set for that conference. We will bring that live to you right here on WNY News Now as soon as it starts. And we will cut into our programming and keep you updated on that front. Here in Chautauqua County, the Department of Health says that the county has a total of 10 positive cases of the coronavirus. Officials say the two recent cases, which were reported yesterday, include a man in his 80s with no recent travel and a man in his 40s with no recent travel. They add that based on the initial review of cases by the health department epidemiology staff, those appear to have had separate exposures to the virus, meaning that they did not expose one another. One person has now completely recovered and was relieved from mandatory quarantine, while one person has died. The other 8 people are now recovering under mandatory quarantine. In total, 25 people are under mandatory quarantine, while 28 are in a precautionary quarantine. 32 are under mandatory isolation. The county has reported 100 negative tests. Now, today, officials are launching an online mapping tool to display data about the positive cases. If we remember, over last week and over the weekend, it was reported that Chautauqua County's Public Health Director, Christine Schuyler, did not want specific individuals' locations released going forward because she was afraid of a mob mentality that might threaten that person's abilities. And Schuyler explained that if you are impacted by someone's exposure and confirmed case of COVID-19, the health department would contact you directly, and that appears to be the same process that's happening now. Coming up tomorrow on the broadcast, Chautauqua County Executive P.J. Wendell is scheduled to join us live, where we will ask him more about that new mapping system that's in place, what role it will play, and more on the COVID-19 outbreak and his efforts to contain it here locally. Well, the Jamestown Hospital opened an outpatient specimen collection site this morning to help with testing for the novel coronavirus. Officials with UPMC Chautauqua Hospital say that starting today, the site will be open from 7:30 a.m. to 3:30 p.m. Monday through Friday at the Jones Memorial Health Center. Doctors will soon direct patients who have received a physician consultation and subsequent referral to get tested for the virus. The hospital staff stresses that the site is not open to the public and walk-ins will not be tested there. Patients who are referred by a doctor will be tested, and they will receive a call from the hospital to set up their appointment. Staff collecting the samples will be outfitted with proper protective gear in order to prevent contamination and spread of COVID-19. Hospital officials say people who suspect they have the virus but do not have high fever or breathing problems should call their primary care physician or their provider's virtual visit options to get advice. Anyone with a high fever or breathing trouble should go to their local emergency department for evaluation and care. but health experts say that you should call ahead first. Well, new projections predicting how long the coronavirus will last and how many Americans will be killed over time are all over the place. According to the latest models cited by the White House, even with strict social distancing, at least 100,000 people will be affected by COVID-19 in the coming weeks. Now, without strict social distancing, that number could be as high as 2 million. The director of the CDC believes as many as 25% of those infected may not show symptoms but can still spread the virus. That may be why Dr. Anthony Fauci says he's leading towards recommending everyone to wear homemade masks. Bryn Gingras has the latest from Washington, D.C.
The White House Coronavirus Task Force presenting a chilling outlook.
This is going to be a rough 2-week period.
Dr. Anthony Fauci says some models project 100,000 or more Americans could die from the coronavirus, and he encourages stay-at-home measures as a key tool to help mitigate the disease.
It's inconvenient from a societal standpoint, from an economic standpoint to go through this, but this is going to be the answer to our problems.
The White House's goal is twofold: slowing the spread in New York and preventing cities like Chicago, Detroit, and Los Angeles from seeing runaway cases over the next 30 days.
There's no magic bullet. There's no magic vaccine or therapy. It's just behaviors. Each of our behaviors translating into something that changes the course of this viral pandemic.
But as states like Illinois watch case numbers rise in New York, the governor says he's worried a lack of federal help for critical supplies will leave him shorthanded.
If we don't have those ventilators delivered in the next week, we're not going to be prepared across the state for the kind of onslaught that we're going to see.
New York Governor Andrew Cuomo frustrated by the lack of a national plan.
So you have 50 states competing to buy the same item. It's like being on eBay with 50 other states bidding on a ventilator.
Meantime, President Trump says the federal government is keeping almost 10,000 ventilators on standby.
We have to hold them back because the surge is coming.
While states struggle to purchase equipment, they also need more trained personnel to treat patients.
Doctors, nurses, CNEs, physician assistants, therapists, social workers. If you're out there, I'm calling you up. I'm asking you, please, to respond.
And in many hospitals, like where critical care nurse Carly Rice works in South Georgia, there's a fear of not being able to do enough to help everyone.
We have what we need, but eventually we're going to run out of space and we'll have to rely on the other communities. And I just pray that each patient is taken care of the way that they need to be taken care of, and we have everything that we need to.
All right, Bryn, thank you for your reporting. The virus is projected to hit the nation the hardest by mid-April. Well, states across the country have issued stay-at-home orders due to the pandemic, leaving many people indoors around the clock. Now, during a recent interview with WNY News Now's Matt Hummel, Chautauqua County District Attorney Patrick Swanson says domestic violence is a specific problem that he's concerned about as the crisis continues.
These are high-stress times where people are going to struggle with their mental health. And that struggle with mental health, along with it comes strain at home. And I just hope, people can stay level-headed. And if someone is violating the law, that I hope the person being abused is able to call and get protection from local law enforcement and seek help from the criminal justice system. Because that's my biggest concern right now, is the potential for domestic violence to become a problem as this crisis as we get further into this.
Now, overall, Swanson expects crime to dip here in Chautauqua County, with most people remaining at home. Well, the Chautauqua County Clerk says that the state is extending some expiration dates for driving documents here in New York. Chautauqua County Clerk Larry Barmore tells WNY News Now that local DMVs remain operational but not open to the public.
We have a half staff working each day. We have a lockbox outside each DMV, and you can drop stuff there 24 hours a day. You have to fill out all the proper forms, get everything you need, and drop it in the drop box with your contact information. And when we get to it, we will call you on the phone and get any information that we need. Plus, we'll get a credit card payment from you, and then we mail everything back to you.
The state has extended all driver's licenses, non-driver ID cards, and vehicle registrations with an expiration date of March 1st, 2020. The clerk says the state will eventually implement a deadline to renew those documents. For more, you can see our full conversation with Clerk Larry Barmore at our website, WNYNewsNow.com. Well, hopefully everybody is having a good day, and we thank you so much for joining us here on WNY News Now as we continue to put facts over fear. Let's check in with the comments and say hello to Lakeith. Hopefully you're doing well, sir. Thank you for joining us. Good to see you here. Hello to Jason. Hello to Nancy. Hello to Linda. Good afternoon to you. Good afternoon to Scott, Pam, Wendy, Lori, Butch, Rod, and Joseph. Happy April to all of you, and happy hump day, as our Norm Rodriguez would normally say. Well, let's now get a check of our weather forecast. Chief Forecaster Dakota Hunter is here with that. Hello, Dakota. Happy April 1st, April Fool's Day.
Indeed it is, and happy April Fool's Day to you. And there's been a lot of talk about trying to cancel April Fool's Day because of all this, but hey, you know what? We need to laugh a little bit. That's what gets us through hard times, is laughter. As you see on the satellite and radar composite, this is no joke right now, and oh, there you go. There's the April Fool's joke for you right there. This is what I see. This is exactly what I see, ladies and gentlemen. Green. This is exactly what I see, but through the magic of television, just like that, you see this. Isn't it amazing how this stuff works? I know. But anyway, satellite and radar, we have a few clouds, and really the clouds are going away this afternoon. We'll be in a lot of sunshine this afternoon as those clouds are finally going away. Pollens, this is starting to become another problem as we're getting into spring and summer. Expect this to rise. We're still dealing with the tree pollen right now as the trees are starting to bud a little bit, and so that means the pollen will be coming back with the trees, and expect those to rise. So allergy sufferers, get ready for this. 43 was the high yesterday, below our average, which is 50, and 80 and 1 below zero are essentially in the record books for this date, nowhere near those through the afternoon. Let's go hour by hour here. Now my clicker's playing an April Fool's joke on me. It doesn't want to work. There it is. Hour by hour, you can see temperatures will be into the mid to upper 40s through the day with lots of sunshine to go around, and that'll continue throughout the rest of the week, and we will talk about it in full detail in just a few minutes. Jack?
All right, Dakota, thank you. You know what? You're such an adamant professional. No matter what we throw at you, it doesn't faze you. Thank you, sir.
You're welcome.
Coming up next, a leader with the Chautauqua County Chamber of Commerce joins us to talk more about how local businesses are getting involved in the COVID-19 relief effort and what resources are available to those who are struggling. And a little bit later on, we are still awaiting Governor Andrew Cuomo's daily press conference, which was supposed to start 15 minutes ago. When that happens, we'll bring it to you live right here. Stay with us as the News at Noon continues next.
You're watching WNY News Now, your source for breaking news.
EagleZip.com is your local one-stop shop for all of your home and business computer needs. Located on Fluvan Avenue Extension, just outside of Jamestown, EagleZip.com sells and services all brands of desktops and laptops, as well as servers and network equipment for your business. All new computer sales include transferring your data from your old computer, plus a 2-year warranty. Call EagleZip.com today.
Stop by EagleZip.com today and let us make computers easy for you.
This is Christine Schuyler, Chautauqua County Public Health Director, with a very important message. We need you to make every effort to protect yourselves and our healthcare workers. If you absolutely don't need to go out, don't. If you have a mild cold or flu-like symptoms, with or without a fever, stay home. If your symptoms are severe, call your healthcare provider. Do not go to the emergency room or urgent care. Do not call 911 or go to the ER unless you are experiencing a life-threatening emergency. The best ways you can help prevent the spread of COVID-19 are to wash your hands often with soap and water, cover your cough, avoid close contact with others. please stay home.
With coverage that matters, this is WNY News Now.
And welcome back to WNY News Now. Sheila Webster, the Director of Marketing, Communications, and Governmental Affairs for the Chautauqua County Chamber of Commerce, joins us to talk more about how local businesses are working to help in the COVID-19 relief effort and to tell us about some resources that are available to them. Sheila, thanks so much for being here today. We appreciate it.
Thank you for having me.
First off, a lot has changed here in the last 2 weeks in regards to what businesses can and cannot do during the outbreak. What role has the Chamber played in helping not only their members, but local businesses here in the community in general?
Our real role has been information. We have really worked hard to try to be an informational resource for the local business community as much as possible. And we have set up some things that provide opportunities for local businesses to communicate with one another, as well as get the information that they need. We have been offering pretty much daily emails on updates for local businesses, especially as the rollout changed over, the state mandates from one day to the next over. First, we went to a 50% workforce and then a 75% and then a 100% mandated closure, except for essential businesses. And then there were a lot of questions around what is an essential business. So we have worked very hard to try to connect our local businesses with those resources that are important for them to know and important to keep up with as things have changed. And then, when the federal government rolled out the stimulus packages, there were a lot of changes that came with those things as well. So all of that information we have tried to collect as many links as possible, as many things that are helpful as possible. We have a special web page on our site. Our site is chautauquachamber.org. We have a special web page set up there with just tons of links for local businesses on the coronavirus and business. There's a special page there. You can get directly to it from our homepage.
And just in the last few days here, it seems like a lot of businesses who maybe were sending people out the door, sending them home because of the new changes in the workforce requirements now are trying to rehash some of their ideas. And I know Todd, who was scheduled to speak on the program, is actually in a meeting right now talking with trying to figure out a way to help those businesses in that way. For the Chamber, does this seem like it's hope now coming from all of these requirements saying, it seemed like economically things weren't looking too great because everyone was staying home and not shopping local. But now with the ability to produce different items like hand sanitizer and face masks, to me anyways, it seems like there is a little bit of light at the end of the tunnel in regards to economics.
Well, first of all, yes, there definitely is some light at the end of the tunnel, and a couple of things have happened. One is there are some local businesses that have retooled quickly to start manufacturing things that are essential at this point. We are aware of at least 2 distilleries in Chautauqua County that are now making hand sanitizer, where previously their distillery was making, alcohol for liquor products. And so that kind of thing. We are aware of at least one manufacturer that now is actually reworked itself to produce face shields for the medical industry. So these things are essential at this point, and that kind of, personal protective equipment, everyone hears the term PPE, those things are very, very important. So we have local people who are at work doing these things that are important in this fight against COVID-19. We also something else happened in just last Friday, when the federal government approved the Paycheck Protection Program as part of the stimulus package. What we saw was a lot of businesses laid people off if they were going to be closed. And now what we've seen, because of that Paycheck Protection Program, there are businesses looking to try to rehire some folks at this point. so that they can hopefully keep them on their payroll and still get some recovery aid for maintaining that payroll if possible.
All right, Sheila, stand by because Governor Andrew Cuomo now speaking live from Albany in regard to an update. Let's listen.
Rural America. Total numbers, 83,000 tested positive, 12,000 people currently hospitalized. That's up 1,200 people, 3,000 people in ICU. 6,000 patients discharged. That's up 1,167. People go into the hospital, they get better, they leave the hospital. Most impacted states, New York is at 83,000. New Jersey is at 18,000. That's Governor Phil Murphy, who's been a great partner to me, a great partner to the people of this state. Governor Ned Lamont, also in Connecticut, has been a great partner. We've done a lot of great work as a region, which is very unusual. You know, those lines between states often become walls, not with Governor Murphy and not with Governor Lamont. We're working together, and we're going to work cooperatively with New Jersey because they have a real problem. California's ticking up. Michigan's ticking up. Florida is even ticking up. Massachusetts, but no one is anywhere near where we are, right? 83,000 compared to 18. Number of deaths, 1,900, up from 1,550. That number will continue to go up. That is people who have been on ventilators for a period of time. If you go on a ventilator, there's roughly only a 20% chance that you will come off the ventilator. The longer you're on the ventilator, the lower the chance you come off. We're still looking for a curve. We're still looking to see where we hit the plateau. Total number of new hospitalized. Again, you see the number goes up and down, but the overall trajectory of the number is up. Change in ICU admissions, bounce here, bounce there, but the overall number is still up. Change in intubations, same thing. The line is basically a line that is going up. Change in number of discharged, line is going up. Why? More people going in, more people treated, more people coming out. Everyone asks the same questions, and they're all good questions. When is this going to be over? What happens? How does it end? And people want answers. I understand people want answers. I want answers. But the answer is nobody knows for sure. Anyone who goes on cable TV and says, or network TV and says, this is what is going to happen, it's not true. Nobody knows what's going to happen. And I understand the need for closure, the need for control. We're at a place we've never been before. We're out of control. I need to know. I need to know. Nobody can tell you. What you do know are facts. And, you know, facts are funny things. What you're now getting are subjective facts. People who are optimists want to interpret it one way. People who are pessimists want to interpret the other way. People who bring their own subjective agenda tend to interpret the numbers a different way. For me, facts are facts. And the facts that we offer the people of this state and the people of this country, they're not pessimistic facts or optimistic facts. They're not interpreted facts. They are just the best information we have as of this time. And I think that is empowering and in some ways relaxing. As I've mentioned to you who've worked with me, I say to my team all the time, I'm interested in your opinion, but I'm interested in your opinion second. I'm interested in the facts first. And give me the facts unjaded by your opinion. Because once a person has an opinion or once a person wants a certain outcome, and they look at the facts through that filter, then you can interpret facts differently. Just give me the straight facts. Sergeant Joe Friday, just the facts, ma'am, just the facts. No opinion. There's something empowering to that. We look for the facts to projection models. That's how we gauge what we do. We follow the projection model. Every day you get additional data, they run that data into the model, and they refine the model. And basically, we then have a composite model, because you have many different people out there with many different models. We use McKinsey, which is a consultant to the state, for this purpose, to basically look at all the models and come up with a composite model. And if people wonder, well, where do you get these numbers, Governor? How do you decide what you're going to do? We have a model, we have a projection, and that's what we follow. The current model, and the model, by the way, even more maddening, the model changes the more data that comes in, because they started with assumptions and presumptions. And then the more data that comes in either affirms or discounts their presumptions that they started with. So they refine the model over time, and the model changes, and the numbers change. But what we're looking at now is the apex, top of the curve, roughly at the end of April, which means another month of this. The apex, the recent number is you could need 110,000 COVID beds. What does that mean? Beds for COVID people, as opposed to other people who are in the hospitals for other reasons. 37,000 ventilators. That is our current model. That model is based on minimum or minimal impact from social distancing. Meaning what? One of the great variables is how effective is the social distancing? Are people doing it? Are they complying with it? And to what extent and how effective is it? Nobody knows that answer. So they do different projections depending on how well social distancing works, how well people comply with it, and then how effective it is. Minimal social distancing impact is where we get the 110,000, 37,000 ventilators. High compliance with social distancing, you still have 75,000 COVID beds as opposed to 110, you're 25,000 ventilators, okay? So when I keep pushing for high compliance on social distancing, it's because high compliance on social distancing will reduce the number. This is what they began talking about, flatten the curve, flatten the curve, flatten the curve with social distancing. This says, this is the difference between high compliance with social distancing and less compliance. If you have high compliance, you're down to 75,000 COVID beds, 25,000 ventilators. Less, it goes up to 110 and 37. Interestingly, both are looking at the same point of apex. It's just a lower apex. Both models say you apex at the end of April, just a lower need at that apex. And that is what we want, because this all comes down to, at the apex, can your hospital system manage the volume of people coming into the hospital system? That's all this is about at the final analysis. Now, there are also different models out there based on different presumptions. People studied China, people studied Wuhan. Well, if you have the same compliance that you had in Wuhan, Wuhan basically just locked up society. I don't even know that if the federal government enacted the Wuhan model that the American people would comply. We have a totally different social structure, governmental structure. So you have different models that project higher or lower. What we're doing with McKinsey is studying all of them and coming up with a moderate model that is a basis for us to make planning decisions, because I have to make decisions. And I want to make the decisions off the numbers, so that's what we're doing. It's not to say that there aren't other people with other opinions. There are many people with many opinions. And some have the apex happening sooner, some have the apex happening later. You can find people who believe the apex will come in 7 days. You can have people who say the apex won't come for 6 weeks. You have that kind of range. You have a broad range on the number of beds. You have a broad range on the number of ventilators. Our course, for planning purposes, is a moderate model, because in truth, the higher models, we don't even have a chance at meeting that capacity anyway. You say over 110,000 beds. There is no possible way we could get there. So in some ways, an overly aggressive estimate doesn't even mean anything to us, because it's just unachievable. People ask, well, what's going to happen? And Dr. Fauci said yesterday or the day before, the days blend together, estimated 100,000 Americans may pass away. Some people have said 100 to 200,000 Americans may pass away before this is over. When is it over? When you achieve what they call herd immunity. How do you say 100 to 200? That's a broad range. Well, it goes back to the other point. Nobody really knows. But 100 to 200, you're saying a significant amount of people lose their lives. There is a group that is funded by the Gates Foundation, thank you very much, Bill Gates, that projects 93,000 Americans will lose their life by the time this is over. That model suggests 16,000 New Yorkers will pass away by the time this runs its course. My guess is, so when Dr. Fauci says 100,000, there are models out there that make these types of projections. And what would that mean to New York? That would mean about 16,000. Frankly, that would mean that New York is only 16% roughly of the number of deaths. I don't even understand that, since New York is so much higher right now. But what that does say to the rest of the nation is, this is not just New York. If you believe these numbers, 16,000 deaths in New York, that means you're going to have tens of thousands of deaths outside of New York. So to the extent people watch their nightly news in Kansas and say, well, this is a New York problem, that's not what these numbers say. It says it's a New York problem today. Tomorrow, it's a Kansas problem and a Texas problem and a New Mexico problem. That's why I say to my fellow governors and elected officials all across this country, look at us today, see yourself tomorrow. And let's address it in New York, and let's cooperate to address it in New York, because it's going to be in your town tomorrow, metaphorically. And if we learn how to do it right here, or learn how to do it the best we can, because there is no right, it's only the best we can, then we can work cooperatively all across this country. The other thing this model says, people say, well, when is it over? 2 weeks, 3 weeks, 4 weeks? This model projects you're going to have a high death rate through July. If this model is correct, this could go through the summer. Now, other people talk about getting back to work, starting the economy, April, May, June. This model says it could go on through July. now the questions become nuanced. Well, could you still be dealing with the virus and get the economy up and running and get people out of their homes? Yes, I think there are ways to do both. Not picking between human life and the dollar bill, because no one is going to pick a dollar bill over human life. But can you come up with a public health strategy that is consistent with people getting out of their homes and starting to get back to work? Yes, you can. My opinion is the best way to do that is to come up with a rapid testing procedure where people can test, they know who's positive, they know who's negative, and they know who can go back to work and come up with a test quickly, and they're starting, that is readily available, that people can do at home, so you can take the test, know where you are, and we can start ending this terrible situation that we're in. Also, you come up with testing and rapid testing. Not only do you get up and get the economy running, you end the anxiety. The anxiety is what is most oppressive here. Not knowing if I'm positive, if my friend is positive, if my loved one is positive, not knowing when this is going to end. The anxiety of dealing with this isolation day after day after day. It's like a bad Groundhog movie, you know? Day after day after day. When does it end? How does it end? I don't know. I'm out of control. I think that testing is going to be the best mechanism to try to work through that. On the good news front, we have new testing available in New York. Regeneron, which is a great New York company, has created 500,000 testing kits at no charge. Thank you, Regeneron. And they are distributing them across the state. Corning, another great company, has donated 100,000 tubes and $500,000 at reduced cost, so we can do more tests. New York is very aggressive on testing. We have been from day one, and we think that has helped us slow the spread of this virus. My favorite topic, young people must get this message, and they still have not gotten the message. You still see too many situations with too much density by young people. They can get it. They're putting their lives at risk. This can kill young people, rare circumstances, but it can. But you get infected, you give it to someone else. So think about somebody else. And I've said this 100 different ways. The compliance is still not where it should be. You saw the models on the differential in the compliance versus major compliance and minor compliance. So we're going to take more dramatic actions. We are going to close down the New York City playgrounds. I've talked about this for weeks. I warned people that if they didn't stop the density and the games in the playgrounds, you can't play basketball. You can't come in contact with each other. That we would close the playgrounds. I've spoken to Speaker Johnson from New York City, who feels very strongly about this, who did from day one. We agreed initially with the mayor that we would try compliance, and the mayor was going to try to use the NYPD to enforce compliance, social distancing in playgrounds. It is still a problem. We're working with the speaker, we're working with the mayor, but we're going to close down the city playgrounds and leave the open spaces available. So use the open space in a park, walk around, get some sun, great. No density, no basketball games, no close contact, no violation of social distancing, period. That's the rule. Other good news, we are working with all the hospitals in the state to do something they have never done before, which is to act as one to cooperate, to share supplies, share staff, support one another, shift patients among hospitals, which really has never happened to any great extent. And the hospitals have been very cooperative, and I want to thank them very much. In this war, we must plan forward for the next battle, meaning we have been behind from day one. This virus has been ahead of us from day one. You don't win a war that way. The next battle is the apex. The next battle is on the top of the mountain. You see that curve? You see a curve? I see a mountain. The next battle will happen at the top of that mountain. That's where it is going to be joined. And that's where the enemy either overwhelms our healthcare system or we are able to handle the onslaught of the enemy at the top of that mountain. And that's what we're planning for every day. But I want to offer you a different perspective that I'm starting to think about, and I think we all should start to think about. As a society, beyond just this immediate situation, we should start looking forward to understand how this experience is going to change us, or how it should change us, because this is going to be transformative. It is going to be transformative on a personal basis, on a social basis, on a systems basis. We're never going to be the same again. We're not going to forget what happened here. The fear that we have, the anxiety that we have, that's not just going to go away. When do we get back to normal? I don't think we get back to normal. I think we get back, or we get to a new normal, right? Like we're seeing in so many facets of society right now. So we will be at a different place. Our challenge is to make sure that transformation and that change is positive and not negative. Let's make sure we're taking the positive lesson and not the negative lesson. You could get wary of intimacy and contact and density, social distancing. Don't go near anyone. What a terrible thing to live with as a human being. What a cruel torture. Isolate yourself from other people. Be afraid of hugging someone. Just think how emotionally and personally repugnant that concept is, right? We crave human connection. And now we're being told that could be dangerous. You can't kiss, you can't hug, you can't hold hands. So how we come out of this and making sure that it's positive and not negative? How do we learn from this? And how do we grow from this, right? Society life, you will get knocked on your rear end. You will deal with pain, you will deal with death, you will deal with setback, you will deal with suffering. The question is, how do you get up? Well, first, do you get up? And second, if you get up, how do you get up? Do you get up smarter? Do you get up wiser? Or do you get up bitter? And do you get up angry? And do you get up fearful? We are in control of that. And we have to start to think about that. And we also have to be smarter from what we went through. How do you make the economy more resilient? What happens when something like this happens again? And something like this will happen again. Oh no, this is a once in a lifetime, never again. Something like this will happen again. We're seeing it in the environment, we're seeing it with floods, we're seeing it with hurricanes. Something like this will happen again. You can't just turn off the economy like a light switch. How do governments work together? You can't figure it out on the fly, what the federal government does, what the state government does, what the local governments do. Figure it out before. Learn the lessons from this. Telemedicine and teleeducation. We had to close the schools. Well, why weren't we ready with a teleeducation system? Why weren't we better at telemedicine? Why didn't we have that capacity rather than having people wait on all these lines to come in to get the same basic diagnosis and the same basic advice? Why don't we have medical supplies made in this country? Why are we shopping in China for basic medical supplies? Why don't we gear our medical research to these types of threats and challenges, which we know are on the horizon? We know these viruses are changing. We know that they mutate. Why don't we get ahead of it? You still have to run society. Let's talk about first responder capacity. We now have first responders who are getting sick, and the workforce is dropping. Well, that was inevitable, right? That was going to happen. What's the backup to that situation? And let's talk about societal stability and engagement at times of crisis. You can't just tell everyone, go home and lock your doors and sit on your couch and order takeout for the foreseeable future. That's not who we are. It's not even a mental health issue. It's just a personal health issue. It's how we relate to one another. We're not built to be isolated for long periods of time and not have human contact. So how do we deal with that? And these are the types of questions that we have to start to think through. But not today. That is the next challenge, I believe. And that is what we're going to have to think about soon. But for now, one crisis at a time, as they say. And we have plenty to handle with the current crisis, preparing for the battle on the Mount, which is what we are doing every day. And that's what we are doing. And not only are we doing it, but we have to succeed at it, you know? Government process is very good at saying, well, we're trying, we're working on this, we're doing our best, we're doing our best. Winston Churchill, it is no use saying we are doing our best. You have got to succeed in doing what is necessary. Tad harsh goes with that expression, which I think you could say tad harsh. Handsome, but a tad harsh. But it's true. And that's what I say to my team every day. This is beyond best efforts. This is beyond I'm working very hard. We have to get this done. We have to succeed. We have to find a way. We have to make it happen because too much is at stake. Last point on a personal note, my brother Christopher, as I told you yesterday, tested positive for the coronavirus. He's at home. He's doing fine enough. He has a fever. He has chills, symptoms of basically a very bad flu. But I think this is illustrative in a number of ways. First of all, anyone can get this disease. Relatively young people, strong people, people who take a lot of vitamin pills, people who go to the gym a lot. Anyone can get this disease. There is no superhero who is immune from this disease. That goes for a New Yorker, as well as a Texan, as well as a Californian. Anyone can get it. No one can be protected from it. I couldn't protect my own brother. With all he knows and as smart as he is, he couldn't protect himself. So anyone can get it, and everyone has to be protected. I understand the data. I understand 80% self-resolve, 20% go in the hospitals. Christopher is not in the category that is problematic. By all the data, he should have it. He'll have it for a period of time, and he will then resolve. If he has bad symptoms, he'll go into the hospital, he'll be treated, and he'll be released. That's what all the numbers say. Even though that's what all the numbers say, when he told me he had the coronavirus, it scared me. It frightened me. Why? Because we still don't know. We still don't know. And even if there's just a 1%, 2% chance, it's frightening. It is frightening. It frightened me. And I deal with all sorts of stuff. And I've seen all sorts of things. And it frightened me. Why? Because we're talking about my brother. We're talking about my little brother. This is my best friend. Talk to him several times a day. Basically, spend my whole life with him. And it is frightening on a fundamental level. And it's frightening because there's nothing I can do, and I'm out of control, and there's nobody who can tell me, and Dr. Zucker can't tell me anything, and Tony Fauci can't tell me anything because nobody really knows. And this situation is the same situation for everyone. For everyone. So yes, I'm frightened for my brother. I'm worried about my brother, as everyone is worried about everyone in their family and everybody they love. I take solace in the numbers and the facts, because you can't divorce yourself from the facts. Otherwise, you go to a place of irrationality. But we're emotional beings. And as an emotional being, it is frightening, and it is unknown, and it is threatening, and it is scary, and people are dying. He's going to be okay. I believe that. He's in his basement. I sent him over a book that could be helpful, Beginner's Guide to Striped Bass Fishing. I hope he picks up some tips from that. But I also want to say to him, because I want him to know, he found out yesterday morning that he had coronavirus. He did his show last night. He did a show last night from his basement. What a gutsy, courageous thing to do. And we talked about it. And in some ways, this can be very instructive, I think, to many people. Because everybody wants to know, well, what happens if you get coronavirus? All right, he did. And he does this show every night. Maybe some nights he won't be able to do it, but he does this show every night. So what's the positive? Show the country what it means to have coronavirus. And that information, that experience, can be helpful to people. And that's why he did the show last night. Okay, I have coronavirus. But you know what? Here I am. I'm doing my show. I didn't fall over. I didn't collapse. It's not a death sentence. Here I am. I'm doing my show. Kudos to him. My pop would be proud. I love you, little brother. And even though this isn't a flattering picture, I did not pick this picture with your mouth open, but it is suitable in some ways. Any questions, comments?
Governor, policy for posthumous testing of suspected cases.
If you could repeat that, please, because I missed it. Also, let's do any questions on coronavirus. If you want to do questions on budget or anything else, let's do them at the end. But I'm sorry I didn't hear you.
All right, Governor Andrew Cuomo updating the press during his regularly scheduled press conference, so around 20 minutes delayed from the noon start hour, talking pretty deeply about his brother, who yesterday was announced that he was and is infected with COVID-19. and trying to urge people in New York State to keep this and treat this as serious as possible. We will continue to follow this and update it on WNYNewsNow.com as we get more. I do want to now, though, turn back to our interview with Sheila Webster with the Chautauqua County Chamber of Commerce. And Sheila, thanks for sticking with us. I want to ask you how important it is to have this cooperation here locally between entities like yourself, government officials, and businesses in keeping the local economy running smoothly during this time, because I imagine businesses are really trying to stay in the fight.
Local businesses are doing everything they can possibly do to keep their little portion of the economy flowing. And we get the sense that, I mean, obviously no local business wants to close, right? But they also want to follow the rules. And so they're doing what they can do. Let me use the restaurant industry as an example at this point. Many, many local restaurants suddenly shifted to doing takeout or curb delivery where they had never done it before. That some of them are just doing tremendous business in that way. They didn't know it was possible, and now they do. So it's been a real fast turnaround and a learning experience for a lot of local business people. Maybe they're using their staff in different ways to take online orders and things like that, and help manage their website. And we applaud them for their ingenuity, for being aggressive in this way. And we would hope that the local public would support those folks. We did work with the Chautauqua County Industrial Development Agency and the Chautauqua County Visitors Bureau and Jamestown Renaissance Corporation. Worked very closely to try to set up chqbylocal.com. It's a website where people can go and find local businesses that are still open, whether it's a food service business for takeout or delivery, or whether it's an essential business that is still open, like auto mechanics are still open. If you have a problem with your car, you can still make an appointment to get it fixed. So there are a lot of businesses that are open under the essential rule, and we hope that people will support them.
Now, on that point, reaching out to customers for those types of businesses that are still open, in addition to that chqbylocal.com, what other strategies does the Chamber recommend businesses to use, and how do they get onto that website?
chqbylocal.com is very easy to find, so they can go on there. We actually have a form on there. If a business is not participating, they do not have to be a chamber member business to participate. They can send us their information, and our staff is loading that in as quickly as possible. We've had, I'm going to say we've had more than 30 local businesses who have submitted information to us in that way, saying, yes, please put us on your list. We're open for business. So we are working diligently to provide that service to businesses. And again, you do not have to be a chamber member to do that. How can customers find it? It's easy, chqbylocal.com. So if you're looking for a place to, get some curbside pickup food tonight for dinner, please go there. We've got a lot of food services listed, and you can sort it by your community. There's a helpful Google Maps integrated with that, so you can find what you're looking for.
And that's really important, too, is for people to know that businesses are taking steps in the community to make people feel comfortable when they come. I just can attest from one last week. On Friday, I went to Sauce here, and it was in and out super quick. I went in, got my food, and got out, and they've been cleaning their doors and keeping things flowing. And to that point, I would imagine for people in the community to say, even though we're asking you to practice safe social distancing, please make sure you still get out and support local.
Yes, and we're so fortunate here in this community, Justin, that most of us can get in our personal vehicle and drive to an independent business and pick up our food, get back in our personal vehicle, and head home to our safe home. And so we all have some level of comfort around that. And the businesses that have remained open really are doing extraordinary work to try to, adhere to all the requirements and keep clean and make sure that, their employees are protected, their customers are protected. So I think people are doing the right thing, and they've really stepped up. It's exceptional.
All right, Sheila Webster, the Director of Marketing, Communications, and Governmental Affairs for the Chautauqua County Chamber of Commerce. Thank you so much for joining us today. We appreciate having you on the broadcast.
Thank you for having us.
Let's now get a check of our weather forecast with Dakota.
Hey, Justin, and thanks for sticking with us as well. Now, we did the calculations on this morning since we're now into April. Where did March rank in terms of temperature? Well, we had 23 above average days throughout the entire month of April, throughout the entire month of March, excuse me. I haven't had lunch yet, okay? And we had 8 below average days throughout the months. That's 31 days. Basic math. So here's where it ranks here. We ranked as the 7th warmest March on record. The average high temperature throughout the month was 40.5 degrees. It also ranks as the 6th least snowiest on record dating back to 1950. We only had 2.5 inches of snow throughout the entire month. But hey, the sun is back, it's shining in full force, and temperatures are up, and away from here, and it will continue throughout the rest of the week here. So here we go with FutureScan. This is the cloud cover on FutureScan. Absolutely nothing through the day. We should be in full sunshine across much of the area. Now tonight, a few more clouds will come our way. We'll call tonight partly to mostly cloudy, and then tomorrow with another storm system squeaking by away from the region, we'll be wrapped in the cloud cover. So we'll call tomorrow partly sunny on average, but some areas could see full sunshine once again, but the majority of the area should be partly sunny, so more clouds tomorrow, but the sun will shine in full force as we head into Friday as well. So zone forecast, the inland areas today, temperatures mid to upper 40s. This is closer to where we should be. Again, the average high is 50 this time of the year, and we're getting there. West we go, young man, to the Lake Erie shoreline. Temperatures here mid 40s as well, with lots of sun though, with a north wind, so that will hold down our temperatures just a tiny bit with that north wind. Satellite and radar composite, clear the clouds away. The clouds are going away, and that'll be the case. But the clouds were slow to clear out today because of this low pressure area that's now off the east coast. We were wrapped up in the flow around the low with this system, but this system has now since moved off the coast, and now the clouds are also clearing out with it. Temperatures right now, we're in the lower to mid 40s across much of the area except Mayville. You're still stuck at 38 degrees right now as of the 1 o'clock hour. So here we go for tonight. It'll feel much colder than this. This is where we're going to range 32 in the deepest valleys to 36 near the Lake Erie shoreline, but it's going to feel colder than that. Now, climatologically, our average low temperature is actually in the 20s, but it's going to feel a little colder than this, though, even though these are the air temperatures with that northeast wind averaging about 5 to 10. Hey, puzzles back on the 7-day forecast because April is Autism Awareness Month, and of course, I talked about it last year. I have a touch of autism, so this is something that hits me, and it's something that I'm proud to so it's something that I'm very proud to represent. So, Autism Awareness Month this month, the autism puzzles will be on the 7-day forecast throughout the entire month. 45 degrees tomorrow, 48 on Friday. More sunshine on Friday, though, on Thursday, though, with more clouds. Here we go. We're back up into the 60s once again for the second half of the weekend into early next week. News continues 24/7 at WNYNewsNow.com and also the mobile app. Thanks for staying with us. We'll see you right back here at noon. Have a good day.